Psychosis. Psychosis is an illness that affects the mind which alters a person's capability to think clearly, make judgments, communicate normally, understand reality, and etc. Different types of psychotic disorders include schizophrenia, which is changes in the mood and behavior in addition to hallucination, schizoaffective disorder, which is schizophrenia in addition to a mood disorder, for example, bipolar disorder, substance-induced psychotic disorder caused by the use of or withdrawal of a certain substance, and psychotic disorder due to a medical condition, which is the delusions or showing symptoms due to a condition that affects the function of the brain, for example, brain tumor or head trauma. Now we're going to talk about the treatments for psychosis. One of the treatments for psychosis is antipsychotics. And within antipsychotics, there are two types. One is typical antipsychotics, which were the first generation of drugs developed to treat psychosis, and they have been available since the mid-1950s. The second type of antipsychotics is atypical antipsychotics, which were the second generation of antipsychotic drugs that were developed in the 1990s. So antipsychotics are used to treat hallucinations, delusions, or other symptoms of schizophrenia. And different people respond differently to different types of medication. When treatment using antipsychotics are suddenly stopped, symptoms can relapse and become worse. When coming off treatment, medication is often gradually decreased. When taken with a certain medication, antipsychotics can cause unpleasant or dangerous side effects. And so, for typical antipsychotics, some common ones are chlorpromazine, haloperidol, perfenazine, and fluphenazine. Typical antipsychotics are likely to cause neurological movement disorders such as Parkinsonian-like movements, like jerking or trembling. Studies show that older adults with dementia have an increased chance of death while being treated on many types of typical antipsychotics. Therefore, this drug is not FDA approved for adults with dementia. Long-term use of typical antipsychotics can lead to a condition called tardive dyskinesia. TD causes muscle movements that a person cannot control. The symptoms can be mild to severe, and sometimes people can recover partially or fully after they stop taking the medication. Side effects of typical antipsychotics include upset stomach, drowsiness, menstrual problems for women, excitement or anxiety, insomnia, nightmares, dry mouth, skin more sensitive to sunlight than usual, and changes in appetite or weight. Some uncommon side effects include jaw, neck, and back muscle spasms, slow or difficult speech, shuffling walk, persistent fine tremor, or inability to sit still, fever, chills, sore throat, or flu-like symptoms, difficulty swallowing or breathing, severe skin rash, yellowing of the skin or eyes, and irregular heartbeat. The second type of antipsychotics that we're going to talk about is atypical antipsychotics. And like typical antipsychotics, studies show that older adults with dementia have an increased chance of death while being treated. Therefore, this drug is also not FDA approved for adults with dementia. However, atypical antipsychotics are less likely to cause neurological movement disorders. Common side effects are weight gain and metabolic abnormalities. It can also increase a person's risk of getting diabetes and high cholesterol. Older types can cause agranulocytosis, where there is a loss of white blood cells, therefore resulting in a weakened immune system. One of these medications is clozapine, also known as clozaril. Some atypical antipsychotics that have been developed that do not cause agranulocytosis include risperidone, olanzapine, quetiapine, ziprasidone, aripiprazole, and paliperidone. Some common side effects of atypical antipsychotics include weight gain, stomach pain, anxiety, agitation, restlessness, dreaming more than usual, difficulty falling asleep or staying asleep, decreased sexual interest or ability, difficulty with breast milk production, vision problems, muscle or joint pain, drowsiness, dizziness, nausea, vomiting, diarrhea, constipation, heartburn, dry mouth, increased saliva, and increased appetite. Another treatment of psychosis is psychotherapy, and psychotherapy is thought to be effective alongside the use of medication. This treatment is mostly positive. However, during psychotherapy, temporary stress or anxiety can happen. Psychotherapy does not cure any type of condition. However, it strengthens the coping skills in a client. The length of treatment depends on many factors, including how serious this illness is, how well one is progressing, how much the one's illness affects their normal day-to-day life, and etc. Cognitive behavioral therapy is one type of psychotherapy, and the basic principle of cognitive behavioral therapy is for psychosis of perception, either real in the case of a delusion or perceived to be real in the case of a hallucination, causes distress. This distress enforces the reality to the perception. Cognitive behavioral therapy challenges the faults in the delusions to alleviate distress, and the results from trials suggest that cognitive behavioral therapy is effective in speeding recovery, reducing symptom severity, and improving quality of life. However, treatment has to persist in order for effects to stay in place. In schizophrenia, especially when a person does not respond well to medication, CBT has found to have stronger effects, particularly in relation to reducing relapse and rehospitalization. Implementing CBT is cost neutral. Another type of psychotherapy is cognitive remediation, and this aims to address cognitive impairments such as distractibility, memory problems, lack of vigilance, attention deficits, and limitations in planning and decision-making. By addressing these concerns, it is hoped that patients will be more able to make informed decisions and will be able to function in social areas. The effectiveness in this treatment has been tested in controlled tests to be undecided.